Now, let's talk about some eye conditions also. Sometimes eyes itch so much.
Okay.
What sometimes causes these itchiness of the eye?
All right. Thank you so much. The body, the Lord has designed a body that it can fight its own threats. Do you get it? Something that is a threat to it. The eye can fight against it. So we have this immune system. That's the body defense system the Lord has or the Creator has made. So so whenever there is any foreign thing or any threat to the body, the immune system comes into play, and then the body is protected from damage. But we have some situations where the body begins to react to things that are harmless, that they are not dangerous, but they are harmless. We call it hypersensitivity. Yeah. So the hyper, when we say hyper, it means high, something that is high. So the body becomes extremely sensitive to some of these things, and then when it comes into contact with them, then it gives an exaggerated response. The response that the body gives to those things is exaggerated. It's needless. Those things are naturally not harmful to the body, but the body just see those things as threat and begin to react excessively to it. And then one of those things bring about this itchiness of the eyes. We have people genetically, they have the tendency to give that exaggerated response. They have what we call atopy. So those with atopy, they normally have allergic conjunctivitis, they have asthma, they have hay fever, they have eczema, they have what we call skin problems, dermatitis and those things. So like the body, the eye also responds to some of these things. So when the eye come into contact with things that are not harmful, but it perceives it to be harmful, it begins to itch, like release some chemicals, and then the chemicals, we call them histamines. So histamines will bring about those itchiness of the eye, sometimes itchiness of the throat, sometimes itchiness of the ears. So mostly those itchiness are due to allergic conjunctivitis.
Allergic conjunctivitis.
Yeah.
What is it?
Okay. Let me throw more light on it. When we say conjunctivitis, we mean inflammation of the conjunctiva. The conjunctiva is a translucent memory. When I say translucent, it's like light can pass through. It's a little bit transparent. It's a translucent memory on the white part of the eye. So the white part of my eye that you see, there's a memory or a tissue or a layer that is translucent covering it. We call it the conjunctiva. Now, the conjunctiva has vessels. It has blood vessels, but they are very faint. They are very, very thin. So when that part, the conjunctiva, gets inflamed, when I say inflamed, like when it perceives threat, it begins to give response to those threats. So it becomes red, it becomes, you see that the blood vessels there on it become larger, and a lot of blood flow to that place, and then you can get tearing coming out of your eyes. So when there's inflammation of the conjunctiva, and it is due to allergies, something that the body is reacting to, then we call that condition allergic conjunctivitis. Do you get it?
Yeah.
Uh-huh.
So apart from, now let's continue with this allergic conjunctivitis you mentioned. Apart from itchiness of the eye, what are other signs that someone has allergic conjunctivitis?
All right. So as I already said, the eyes become red. Yes, the eyes become very, very red, and tears begin to come out of the eyes. Sometimes the eye color, apart from turning red, it can become brownish. Like a lot of pigment come into the eye. We have pigmentation of the conjunctiva as well. Then pains. Every inflammation comes with pains. So the eye, there is pains in the eye. Yeah, so tearing, redness, pain. Yeah.
Okay. Other types?
Yes, there are types. There are about 4 types of allergic conjunctivitis. The first one I would like to talk about is the acute allergic conjunctivitis. When we say acute, as I already said, is of recent onset. You get it? So you don't have any itchiness of the eyes. All of a sudden, you begin to get itchiness. Your eyes become feel so itchy. You see that. So that it means that it's acute. And people who have acute allergic conjunctivitis mostly have swollen eyelids. The eyelids become swollen, and see they become so puffy. Yeah. So and then they get tearing in the eyes and those things. Then we have another type we call seasonal or perennial allergic conjunctivitis. So with the seasonal ones, as the name suggests, seasonal, the itchiness come periodically. They have such people, they know the times that their itchiness come. Do you get it? So sometimes when it's getting to Hamatan, November, December, a lot of people have itchiness of the eyes, and it's because of this seasonal allergic conjunctivitis. Then we have another type we call vena keratoconjunctivitis. When kerato comes in, it means that the cornea is also involved. Now the cornea is the clear part of the clear front part of the eye, but we see it as black because there is a tissue, a structure behind it which is black. So we see through the cornea and see that black thing. So we see it as black, but it's actually clear, a transparent structure. Now, when somebody has this vena keratoconjunctivitis, the person get itchiness of the eyes. The eyes become brown, very, very brown, like the color of Milo. Yeah, it becomes like Milo. It becomes very, very brown. And then the cornea, the black part, when you look at it, you begin to see you will see some things on it, some things on it, and then under the eyelid, the lids to some things begin to develop there. We call papillae. Yeah, they are raised structures there, and they can scratch the surface of the cornea, and then cause problems. You get it? So the vena keratoconjunctivitis is very serious, and it's mostly found in children, boys especially. Yes, young boys. So like 6 years and those stuff, they normally present with this vena keratoconjunctivitis. But as they grow with time, when they get past 25, get into 30 years, those things subside. Their symptoms calm down. They don't get a lot of it. But when they are young like that, it's very severe. And then the last one that I would like to talk about is atopic allergic conjunctivitis. And this one mostly develops at old age, when you get to like past 40 years. Mostly those who have asthma, those who have atopy, like the ones that I talked about, asthma, high hay fever, we have eczema, dermatitis, like skin problems and those things. They mostly develop this type of allergic conjunctivitis at their old age, like 40 years and over. Yeah, so we have acute allergic conjunctivitis, seasonal or perennial allergic conjunctivitis, vena keratotic conjunctivitis, and then we have atopic allergic conjunctivitis.
Okay. Now let me ask, is it treatable? Can it be treated?
Yes, we can treat allergic conjunctivitis, but mostly we manage it. You know, it's allergy, some things your body is reacting to, and it could be anything. Mostly people react to dust. Yes, in our part of the world we have a lot of dust, and we cannot avoid them. People react to dust, others react to pollens from flowers, then others react to mites, some insects like in the house, and others react to some particular kind of food. It could be like most common ones are groundnut, the peanuts, the nut product, peanut, tiger nut, and those stuff. A lot of people react to them. A lot of people react to milk. When they take milk, they begin to feel itchiness of their eyes. Others also react to maize food. Meals from dishes made from maize. Yeah. So, and then other people also react to strong scented things like perfumes, body spray. Okay. And then we have mosquito sprays like this. We have weedicide, pesticide, all these things. People react to them. So it's up to you to identify those allergens. If you want to treat, you have to identify your allergens and then avoid them. That is the main treatment. If you want your itchiness, the itchiness of your eyes to stop, then know what you are reacting to. And when you know them, when you get to know of them, then you avoid them. You get it? You don't take so much of foods that you react to. You try to avoid dust and smoke and those stuff. That's the first and main treatment. Then mostly we give medications. But before even the patient comes to clinic, we also advise that they do warm compresses whenever there is itchiness of the eyes. When the eyes begin to itch them, they should get some chilled water, not the iced one, but a cold one, and then put it on their eyes like that for maybe 3 seconds and switch it to the other for another 3 seconds. They should do that. The itchiness will subside, it will calm down. Then they can calm. They will have some relief of their symptoms. But when they calm and then the symptoms are still there, we can give them some medications. We mostly give artificial tears. The tears is to dilute the allergens in the eyes. If it is due to pollens or dust or something, you give the artificial tears to dilute it. Then we have, I mentioned histamines. They are the chemical mediators, the chemical substances the body releases in response to those allergens. So we give antihistamine. These medications inhibit the histamine from working. So if they don't work, then there is no itchiness. Do you get it? So we give antihistamines, and then the histamines are released from specialized cells of the body we call mast cells. Those mast cells degranulate to release the histamines. So we give mast cell stabilizers. These medications stabilizes, and they stabilize the mast cells so that they don't degranulate to release histamines. Then we have other medication we call steroids. Now, when we give these medications and they are not working well, then we can go ahead to give steroids. I mentioned that steroids can cause problems like glaucoma. Yes, so mostly we don't want to give them. But if the itchiness is so severe, like in vena keratoconjunctivitis, where the cornea has gotten involved, then we can give steroids. Now, we start with mild steroids. We have strong steroids and we have mild steroids. So mostly we start with the mild steroids. We give mild steroids so that we don't cause a lot of harm to the eyes. So the steroids are very good and they are quick action. They act very, 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 very well. So they help to relieve you of your symptoms. And then if the steroids are still not working, then it's an immune problem. So we have immunomodulators that we can give. So we can give those drugs to help to suppress your immune system so that they don't react so much to those allergens. So these are some of the things we do to manage allergic conjunctivitis.
All right, that's fine.